Top 15 important facts about depression. 1. 1 in 10 people will have a depression in their lifetime. 2. Because depression can lead to self-harm including suicide, it is important to note that 1 of every 25 suicide attempts results in death. 3. Some types of depression, especially bipolar depression, run in families. 4. While there are many social, psychological, and environmental risk factors for developing depression, some are particularly prevalent in one gender or the other, or in particular age or ethnic groups. 5. There can be some differences in signs and symptoms of depression depending on age, gender, and ethnicity. 6. The first step in getting appropriate treatment for a depressive disorder is a complete physical and psychological evaluation to determine whether the person, in fact, has a depressive disorder. 7. Depression is not a weakness but a serious mental illness with biological, psychological, and social aspects to its cause, symptoms, and treatment. A person cannot will it away. Untreated or undertreated, it can worsen or return. 8. There are many safe and effective medications, particularly the SSRI antidepressants that can be of great help in the treatment of depression. 9. For full recovery from a mood disorder, regardless of whether there is a precipitating factor or it seems to come out of the blue, treatments with medications, phototherapy or electroconvulsive therapy, ECT, or transcranial magnetic stimulation, TMS, as well as psychotherapy and participation in support groups are often necessary. 10. Adolescents who suffer from depression are at risk for developing and maintaining obesity. 11. Depression can coexist with virtually every other mental health condition, aggravating the status of those who suffer the combination of both depression and the other mental illness. 12. Depression in the elderly tends to be chronic, has a low rate of recovery, and is often undertreated. This is of particular concern given that elderly men, particularly elderly white men, have the highest suicide rate. 13. Depression can increase the risks of developing coronary artery disease and asthma, contracting the human immunodeficiency virus, HIV, and many other medical illnesses. 14. Depression is usually first identified in a primary care setting, not in a mental health professional's office. Moreover, it often assumes various disguises, which causes depression to be frequently underdiagnosed. 15. Some will only experience one depressive episode in a lifetime, but for most, depressive disorder recurs. Without treatment, episodes may last a few months to several years.